My name is Miley Hewitt. Today we're going to be shooting a skull trigger. So I'm going to go ahead and bring my patient in. Hello.
Hello.
Omar?
Yes.
Hi. Can I get your first and last name?
Omar Khan.
And your date of birth?
January 30th, 1992.
Perfect. What brings you in today?
My head hurts.
Okay.
I took a tumble and
no.
now it hurts, so I'm...
Okay. I'm sorry to hear that. Well, we'll go ahead and get some x-rays done and see if there's anything going on in there, okay? Is there any chance you're pregnant?
No.
No? Okay, good. So I'm going to have you come over to this stool. Take your time. Alright, so we're going to go ahead and prep our bucky for our patient. Wipe it off with some alcohol, make sure it's nice and clean for when the patient arrives. We have our tube detented at 40 inches for all of the projections. And go ahead and throw that away. So first I'm going to have you face this bucky. We're going to start with our PA Caldwell method. We're going to put a 15-degree angle on the tube. We're going to have, can I have your front of your forehead and your nose on the bore. The OML and the mid-sagittal plane perpendicular to the IR. We're going to have the central ray exit at the level of the nasion. I'm just going to move this board just a tiny bit, okay? There we go. Right there. I'm going to put my left marker on the board. You can go ahead and close up this coloration a little bit. Alright, so I'm going to use a technique at 85 at about 14 mass. Go ahead and stay still, Omar. X-ray. Alright, so for our next projection, we're going to do a left lateral projection of the skull. I'm going to change my angle back to 90 degrees. I'm going to have my patient oblique their body slightly, so I'm going to have you face that wall, just right about there. Have you bring your face up as close as you can. So we're going to have the IOML perpendicular to the front edge of the IR. We're going to have the central ray enter 2 inches above the external auditory meatus. Right about there. Make sure your hair is kind of throwing me off here. Put this down a little bit. You're going to have that board move just a tiny bit. Right there. Alright, so we're all in. Technique at about 85 at 6.5 mass. We're shielded. Go ahead and stay still. X-ray. Alright, we're going to do our AP axial Townes method. We're going to put an angle at of 30 degrees. This way. So your back is up against that plate. We're going to change our marker to the right side. R is going to enter 2 inches above the glabella and through the foramen magnum. we're gonna make sure that the OML is perpendicular to the IR. So can I have you just bring your forehead down or look towards the ground a little bit? Perfect, right there should be good. We have a little bit of OID, but that'll be okay, just so we can get the angle good. Go ahead and we're gonna go ahead and use the technique at about 85 at 20 max. Go ahead and stay right there. X-ray. Alrighty. So next we're gonna go ahead and do the submental vertical Schuler method. So we're going to bring our tube back to a 90-degree angle. We're going to have the tube, your seat out a little bit. Perfect. Alright, so we want to get the IOML parallel to the IR. So I'm going to have my patient bring their head back as far as they can so that the top of your head is touching the bucket. Perfect. Good job. Okay. So we're going to have our central ridge. So our center between the mandible and past the 3/4 superior to the EAM. Alright, that looks great. Good job. Make sure I write markers on there. Go ahead and stay still. We're going to use a technique at about 85 at 28 mass. X-ray. You can go ahead and relax. We're all done. With all the
Now that we have completed our images, we can evaluate to make sure that they are of acceptable quality. Our first image is our lateral projection. This image is good because it demonstrates no rotation or tilt of the cranium. This can be seen by the superimposition of the orbital roofs and greater wings of the sphenoid. Superimposed mastoid regions and EAM, as well as superimposed TMJs and the stella turcica in profile. Next is our AP axial skull with the Town method. In this image, we want to see the dorsum sella and posterior clinoid process within the foramen magnum. The appearance of this shows that the OML of the skull was properly aligned perpendicularly to the buccal with a correct 30-degree caudal angle on the tube. If the IOML was perpendicular to the buccal instead, a 37-degree caudal tube angle would be used. This image also shows good positioning by demonstrating symmetrical petrous ridges and equal distance from the lateral borders of the skull to the lateral margins of the foramen magnum on both sides. Next is our PA axial projection with the Codwell method. Since the CR was angled at a 15 degrees caudad, the petrous ridges should be demonstrated in the lower third of the orbits. If the tube did not have an angle, the petrous ridges would fill the entire orbit. This image also shows good positioning by having no rotation or tilt, which is demonstrated by symmetrical petrous ridges, equal distance from lateral borders of the skull to the lateral borders of the orbits on both sides. And the mid-sagittal plane of the cranium is aligned with the long axis of the collimated field. This is our SMV, or submental vertical projection Schuler method. In this image, we want to see the mental protuberance superimposed over the anterior frontal bone and the mandibular condyles anterior to the petrous ridges. This shows good positioning of having the IOML parallel to the IR. You can also see no rotation of the cranium by seeing equal distance from the lateral borders of the skull to the mandibular condyles on both sides.